Chapter 1, What is a heart attack or myocardial infarction? S1, in this video, we'll learn about what is a heart attack or myocardial infarction. S2, heart attack is the death or necrosis of a segment of heart muscle due to the loss of blood supply. The blood supply is usually lost because a coronary artery, one that supplies blood to the heart muscle, is blocked by a blood clot, coronary thrombosis. If some of the heart muscle dies, a person will experience chest pain and electrical instability of the heart muscle tissue. S3, heart disease is a very general term used to describe all the different disorders and diseases that can affect your heart and its operation. S4, one of the most common causes is oxygen starvation. This is usually the result of a blockage in the arteries that carry the flow of oxygen-rich blood from the lungs to the heart. S5, this condition can lead to heart damage, and if left untreated, the damaged heart will undergo necrosis. In other words, the heart cells will start to die. Oftentimes, this condition is caused by a buildup of a waxy substance known as plaque. Usually, it takes many years for this substance to build up to the point where it becomes a problem and blocks the coronary or heart arteries. The medical term for this phenomenon is atherosclerosis. S6, when an area of plaque builds up, it can cause irritation and swelling, and eventually, it can rupture. This starts the body's natural defense systems within the body forming a blood clot around the area. If the clot becomes big enough, it can result in the artery being partially or totally blocked. This condition, if not treated quickly, can result in the areas of the heart that rely on being fed by this artery beginning to die, with otherwise healthy tissue being replaced by scar tissue. Sometimes this condition is not obvious, so is not discovered, leading to long-lasting heart health problems. S7, a heart attack (MI) can be caused by many congenital conditions or conditions that were present when a person was born, as well as those that develop over a lifetime, such as angina. S8, now let's talk about the symptoms of a heart attack or MI. It should be pointed out that everyone is different, and some people will have no symptoms at all or experience very mild symptoms. Often this is referred to as the silent heart attack. It usually happens with people who have diabetes. Common symptoms most people experience when having a heart attack are as follows: chest discomfort or pain. Sometimes people will experience a sudden sharp pain, and other people will have a mild but noticeable chest pain. The feelings can last anywhere from just a couple of minutes up to 3 or more hours. Discomfort in your upper body. Many people feel discomfort, distress, or uneasiness in one or more parts of their upper body, such as the jaw, neck, shoulders, back, or arms. Sometimes people also feel this in their upper stomach. Shortness of breath. Often people have shortness of breath with or without chest pains. Sudden feeling of dizziness, having cold sweats, and nausea or vomiting are symptoms more common with women and people who are overweight. Feeling unusually tired. The feeling of being tired or weary with no apparent cause, and often waking after a long sleep feeling tired. This feeling can sometimes go on for days at a time. S9, often people, especially older people, will experience some of these symptoms and will just ignore them, thinking they are signs of aging, but it is important, if you feel any of these symptoms even mildly, to seek medical advice, especially if they are severe or you experience more than one of the symptoms. How to diagnose a heart attack or MI? S10, so how to diagnose a heart attack or MI? These are some other symptoms of a heart attack or MI that are often included when someone is having a heart attack. If you only have one of these symptoms, you are probably not having a heart attack. If you experience any of the following, is it wise to have a medical checkup? If you or anyone that you know is having 2 or more of these symptoms, then it is advisable to call emergency help right away. Prompt medical care and treatment can prevent or limit organ damage and may even save your life. It is better to be safe than sorry later. S11. If you are having difficulty breathing or shortness of breath, feeling weak or fatigued, feeling that you are unusually tired with no apparent reason for long periods of time even after sleeping, swelling in your feet, ankles and legs, edema, feeling an irregular or rapid heartbeat, a reduced ability to do normal exercises. S12, having a persistent cough or wheezing, often with white or pink phlegm. You may feel confused or fuzzy, lightheadedness. Sometimes people find it hard to concentrate and stay alert, often seeming to daydream quite often, losing consciousness, fainting, blacking out or passing out. Your heartbeat may suddenly change for no apparent reason. It could slow down, start to beat faster or beat rapidly and continuously. You could feel cold or start sweating. Your hands and feet feel cool or cold. S13, you may have a weak pulse, you can feel nausea and experience vomiting, your urine output may decline or cease altogether. Most people who experience heart attacks feel discomfort on the left side or the center of the chest. It can feel different for different people. Sometimes it manifests as pressure, fullness or a squeezing sensation, often with pain, while other people feel indigestion or heartburn. These feelings usually last for a while and often can go away and then return. S14, often people are unaware they have had a heart attack, as not all heart attacks start with a sudden sharp pain in the chest. As seen in some movies. Everyone is different and each person will have their own set of circumstances that will dictate how their condition will manifest and which symptoms they will have. Often people have few symptoms and they are surprised to learn they already have had a heart attack when they visit their doctor for a routine checkup. If you are aware you or someone near you has a heart attack, do not take them or drive yourself to a hospital. With severe heart attacks, every minute counts, so if possible call a hospital and have an ambulance and medical team come to you to start treatments as soon as possible. They usually begin immediately, even on the way in an ambulance going to the emergency treatment room in the hospital. What are the common causes of heart attacks or MIS? 15. What are the common causes of heart attacks or MI apart from trauma from accidents or misadventures such as damage caused to the heart during a heavy fall, in a motor accident when the body is slammed into a steering wheel or stopped abruptly with a seat restraint on, or some birth-related conditions? Most heart disease is directly caused by dietary and lifestyle choices. Foods to avoid. A. Refined salt. B. Refined vegetable oils. C. Refined carbohydrates. D. Artificial preservatives. E. Artificial preservatives. F. Processed and factory-raised livestock. S16. The most important things to avoid are too many processed foods such as, avoid refined salt, use only natural, unprocessed sea, rock or Himalayan salt, avoid all refined vegetable oils, use only cold-pressed or centrifugally extracted coconut, palm or olive oils, avoid refined carbohydrates, especially white flours and products, avoid artificial preservatives, flavorings and colorings, avoid processed and factory-raised livestock. You also have to avoid smoking. Use alcohol in moderation. Try to minimize emotional stress. S17. Avoid smoking or other people's secondhand smoke. Avoid or use alcohol in moderation. Try and minimize emotional stress as much as possible. S18. Chest pain, cardiogenic vs non-cardiogenic. Most people experience chest pain to some degree at one time or another over the course of their lives. This is often caused by anxiety because chest pain is so often associated with heart disease. Fortunately, almost all chest pain has little to do with the heart, but it is not something you should ignore. Understanding the difference between the different types of chest pain, those pains that are considered to be heart-related and those that are not, can reduce stress and anxiety, both of which are major contributors to heart disease. The chest and lung areas are made up of many different structures, all of which can produce pain. The most common type of pain and/or tenderness is in the muscles and bone joints around the chest. The lining or pleura around the lungs can be associated with pain if it becomes inflamed or irritated, but the lungs do not contain any of the nerve connections that will induce the feelings of pain. S19. The esophagus, or the tube from your mouth to your stomach, is another area in your chest that can give you pain. Heartburn, as it is often referred to, or refluxing, has nothing to do with your heart, but can often give a pain that feels like a heart disorder. The esophagus can also have or give spasms, which is also non-cardiogenic. Cardiac or heart-related chest pain is more often experienced in the mornings. S20. Cardiac or heart-related chest pain is more often experienced in the morning. Artificial symptoms include a dull, constricted pressure with burning or squeezing sensation instead of superficial pain. People usually find that the pain comes from the deeper areas of their chest. However, it can be difficult when it comes to describing the location of the pain. S21 symptoms include a dull, constricted pressure with burning or squeezing sensation. Instead of superficial pain, people usually find that the pain comes from the deeper areas of their chest. However, it can be difficult when it comes to describing the location of the pain. It may feel like the pain originates from all areas such as back, neck, head, and throat, or even from the arms, often the left upper arm. Not knowing where the pain comes from, people commonly describe that the pain came out of nowhere. S22 chest pain is often brought on by some form of exertion like carrying a heavy bag, sweeping, or digging. Extreme temperature while exercising or working can also cause a heart attack. It can also follow after eating a heavy meal, then doing physical work. These types of pain usually last as long as the physical activity you are doing continues, but in most cases reduces quite quickly once the activity that brought it on is stopped. Some forms of heart-related pain, such as angina, can be aggravated by lying down, but standing or sitting and even leaning into the discomfort area can help to relieve it. If you feel these types of discomfort or pain, then it is very important to seek medical help urgently. Other types of chest pain that are not related to the heart most often manifest in or towards the end of the day. The pain often feels much sharper and is usually in one area that can be identified easily. This type of pain normally occurs without any real warning or specific reason. S23 other types of chest pain that are not related to the heart most often manifest in or towards the end of the day. The pain often feels much sharper and is usually in one area that can be identified easily. This type of pain normally occurs without any real warning or specific reason apart from doing an unusual activity or lifting and stretching at angles you are not used to. Heartburn may develop after eating oily or high carbohydrate foods. S24 heartburn may develop after eating oily or high carbohydrate foods. Often these types of pain come and go quickly, sometimes lasting only a few seconds or minutes. At other times they may remain for several hours. Simple exercises, especially breathing exercises, will often help relieve or stop this type of pain altogether. S25 simple exercises, especially breathing exercises, will often help relieve or stop this type of pain altogether. It will usually respond well to analgesics such as aspirin and heat packs. What your medical professional will ask for: your age and sex, your eating habits, your physical history. S26 what your medical professional will do: your health professional will usually ask you a series of questions such as your age and sex, ask about your eating habits and your physical history. They will take your vital signs such as weight, blood pressure, temperature, and may do a test to determine your body fat ratio. This is so they can make a realistic assessment of your condition. If you are a 25-year-old gymnast or martial arts student who has just started lifting weights and doing a bodybuilding course, then it is safe to assume that your pain is muscular in origin. If you happen to be a 56-year-old male who is a heavy smoker and drinker, as well as someone who does little physical work, a high-stress job, and also has high blood pressure, eats mainly processed foods, as well as having a family history of heart disease, then it is safe to assume that your health professional is going to be looking for a heart-related reason for your pain. This is because you would be in the at most risk category of those who may have a heart attack. You will probably be asked to undergo a variety of tests and possible chest X-ray to find out what your problem is and work out ways to remedy this. If you have any of the symptoms of heart disease and/or are experiencing chest pain, you should get your medical health advisor to examine you. S27 it is very important: if you have any of the symptoms of heart disease and/or are experiencing chest pain, you should get your medical health advisor to examine you if you experience more than 2 of the symptoms. In the cases where it is found that there is a heart problem, then finding it early and treating it will give you the best chance of a full or satisfactory recovery over the shortest possible time.